Well, good morning and good afternoon. I'm Frank Mallicoat here with Fox in the San Francisco Bay Area. And my guest today is Dr. Jeremy Howard. He's at a UCSF. He's a research scientist. Jeremy, good to have you with us.
Thanks. It's nice to be here.
Good to have you with us. Let's talk first. CDC is considering updating its guidelines on the use of protective masks. Right now, it's for doctors, medical workers, as they are on the front lines, and of course, the patients that have the virus. How about for those of us that don't have the virus? Should we be wearing a mask right now?
Well, if you don't have the virus, you don't particularly need a mask. But the problem is you don't know if you don't have the virus. So about half of people that have the virus have no symptoms. And in fact, in the early days of having the virus, nearly everybody has no symptoms. And what scientists now know is that it's during the early days of the virus that it actually, that's when you're most infectious. So since nobody knows if they have the virus, everybody has to wear a mask.
So if you're going down to Costco or going to Trader Joe's, you should have
Yeah,
something
you don't
to
need it at
protect yourself.
home when you're with your family.
Right.
But yeah, if you're going to be out in public and you're not wearing a mask, you are putting your community at risk.
Can you talk about the spread? And I guess when we speak, we may not realize it, but microscopic spit, something is coming out of us at times.
Right,
Um,
right.
you may not
It's
even
kind of
know it.
gross.
Well, it is kind
Yeah,
of gross, but it's happening, is it not?
yeah, it is happening. I mean, sometimes I notice, like when I go to clean my laptop computer screen, there's tiny little
Yes.
circular bits. That's the leftovers of that little droplets. And it's not just when you're yelling or singing, but all the time. Scientists at Stanford and MIT have actually studied kind of this under a laser system, and they can actually see these microparticles flying out. Every word, every language, every level of volume. Some things go further, some less far. But if you're one of these people that's infected and doesn't know it, then each of those little particles has millions of bacteria, of viral particles in it. Now, if they hit somebody's nose or mouth or eye, that person can become infected. And depending on age, particularly if that's an older person, then there's a very high chance that they're going to end up requiring ICU support. And if this is in a place like New York City or parts of Italy where ICUs are getting overwhelmed, they might not be able to even get that ICU support. And we've seen in Italy, for instance, where this has happened, the death rates are getting up to 10%. Like this is a very, very, very dangerous illness, particularly when you don't control the community spread.
So in terms of masks, we know that there's a shortage of them out there, but
Correct.
you can make them yourself, can you not?
Yeah, exactly. So we've got a shortage of what we call N95 respirators. So an N95 respirator are the kinds of masks that are needed for what Oxford University calls aerosol generating procedures. This is like something like intubation, where you're doing pretty forceful interventions with a patient in a hospital, which is causing a lot of fluid to get ejected into the air. That's where we know that we need the N95 respirators. Now, unless you have some kind of home surgery where you're doing aerosol generating procedures, you don't need
Hmm.
N95 respirators. There's no science or evidence to suggest that's helpful. What we do know is helpful is any layer of cloth or towel barrier between you and the outside world blocks those little bits of saliva, both from you and from others. 2 layers of cotton and a piece of paper towel works great. So Cambridge University studied this and they found that 2 layers of cotton is pretty good. Shenzhen hospital scientists studied this as well, and they found that under an electron microscope, paper towel is like perfect.
Hmm.
So we actually have this website now, masksforall.co, that's just the number for, where I've got a video showing you how to cut up a t-shirt, pop a piece of paper towel in, and tie it behind your head. And you actually get a kind of scientifically validated mask to protect you and your community.
So you could grab an old T-shirt, maybe an old sheet, a bath towel, something like that.
Yeah, exactly. Any of those things works fine. They were all studied by uh, Cambridge University scientists. And if you're more, so that's all I can handle. I'm not a crafty guy. If you're more
Mm.
handy with a sewing machine, there's lots of patterns out there showing how to sew one. And my mother-in-law was kind enough to actually make me one now. So my old cut-up T-shirt, scruffy version, has now been officially replaced with a very elegant-looking pattern.
Well, there you go. Now, what about reusing them? I mean, they're not to, you can just simply wash them. That's okay. And to keep using them, that kind of
Yeah,
thing.
yeah. So when you go out in public for your weekly essential shopping trip or whatever, um, there are likely there's a good chance that there's going to be some people around you that are infected with the virus and don't know it. And so if they're talking or they cough or yawn somewhere around you, some of those droplets might end up on your clothes, on your mask, on your
Mm.
glasses, whatever. So particularly with the mask, when you breathe in, some of those droplets might actually get sucked towards you. So certainly you don't want them in your face. So good to at least have the layer of cloth protecting you a bit there. But at the end of the shopping trip, you kind of got to work on the assumption that, yeah, maybe there's some virus particles in that mask. So take it off from the back, not from the front, um, and pop it in some soapy water. And the science clearly shows that soap destroys the lipid layer that basically keeps the virus together. It deactivates the virus. So wash it up with soapy water, throw away the piece of paper towel, and remember, now you've touched it, your hands might have virus on as well, so give
Wash
them a
that
wash
out.
too.
How about your clothes? If you're out shopping, your jeans, your shirt, that kind of thing, should
Well,
you wash those
it
every
de-
day as well?
it depends, how far up the caution level you want to dial it up. If you're very at risk,
Mm.
maybe. Um, some research that has just come out shows that uh, this virus is mainly spread through droplets, not through contact. So it can spread through contact, but it's not the primary mechanism. Also, clothes is not a material that is nearly as problematic. It tends to hang around for longer on like plastic, shiny metal surfaces, except for copper. Um, so, for me, I'm not being too cautious about my clothes. But it depends how much time you have and how cautious you want to be.
What advice would you give those people that say, "Oh, I can go out every day. I'm going to hit Trader Joe's. I'm going to go shop." Um, is it best to do just stay home? And if you got to go
Yeah,
out 1 day a week, that
right. So there's no way to 100% protect yourself or others. It can't be done. So each time you go out in public, you're putting yourself and the people around you at risk. So the less you do it, the lower the risk. Um, when you do, make sure that you're 6 feet away from everybody as much as you can. Sometimes it's not possible, but try. And if you are having to get a bit closer to somebody, just turn around so you're facing the other way.
hmm,
So if they talk, their droplets are not going to end up in your face. So social distancing is super important. Hand washing, super important. But we know that masks are also super important. One of the reasons we know, other than the basic scientific research, is you just look around and see. In countries like South Korea and the Czech Republic, where they weren't using masks, and then there was legislation that came in and they started using masks, you see the curves suddenly flatten. So actually, the Czech Republic did it just a few weeks ago. And until then, Austria and the Czech Republic had their case rates just going up at the same speed. And then suddenly they've diverged
hmm.
dramatically. And Austria has like now 5 times the deaths, despite having the same population. So it can really really help get us all back, to work sooner, get the economy going sooner, and much more importantly, could save hundreds of thousands of lives at a US level. And we're already hearing, like President Trump was asked about this yesterday. They said, "Would you put on some kind of homemade mask?" And I think they specifically said like a scarf. And he said, "Yep, I would do it." So
Oh,
even the political leadership is now saying, Dr. Fauci, the country's leading infectious disease specialist, has stated every day for the last 3 days he thinks this is a good idea also.
If we knew this information about South Korea and the Czech Republic, why haven't we been doing it?
So the Czech Republic information's only been recent. So they only did this a few weeks ago. And it's only been in the last few days that there's been like, because it takes a couple of weeks for the infection to kind of spread. We're just seeing the impact now. South Korea, it's not just South Korea, Mongolia, Hong Kong, Taiwan, they all clearly have shown this for months. There's this real problem that Western political leaders, health policy experts, and scientists have not been watching and learning from the East Asian countries that have a history of pandemics, recent history of pandemics, and therefore scientists and doctors that have been studying them. And so we haven't been learning from them. And this is a real shame, because South Korea, their initial death toll was kind of tracking Italy day by day, super close. Then they did the masks thing and a few other stuff as well, like rigorous testing, tracing, quarantine for those that might be infected. Today, their death toll is something like 100 times less.
Wow.
than Italy. So it's time for us to stop ignoring the fact that there are people that don't speak our language and they don't look quite like us, but they've got some expertise that is saving their lives. So we may as well use it too.
Do you see this going on well beyond this year? People wearing masks more in public?
Yeah, I think it'll have to. I mean, fingers crossed that we get some really fantastic medical interventions. But remember, the common cold, 25% of the time, is caused by coronavirus, a different kind of coronavirus. We haven't cured that. We haven't cured the cold, just despite a lot of people being very enthusiastic to do so. This is not something that's super easy to just go ahead and find a successful vaccine for, and it mutates, right? Just like the flu mutates, and we haven't got rid of the flu yet. So it seems pretty likely that this is going to be something that is a part of our life for a few years to come, and we're going to have to find ways to live with it. And one of that will be to really step up hygiene, and one of those ways is by using masks.
I think a lot of things are going to change, even the way we're doing this interview right now, and the way we're providing news here in the Bay Area and all over the world. How about the way society greets people and interacts with people, handshakes, hugs? That's going to change too, don't you think?
Yeah, I would have thought so. And again, in East Asia, you already see this. There's kind of more of a bowing or
hello, yeah, right,
little prayer or little, whatever. Yeah, handshakes are gross. Let's get it out there. I mean, who knows where this has been? You don't want to touch it, right? Come on,
high five. There we go. And the high five is gone too, for crying out loud.
Exactly. No, look, I mean, I grew up in Australia. I've lived for 7 years in the US. I'm a very Westerner. I don't feel, it always felt weird to me wearing a mask, even after I started doing the research. But now that I've been doing this for a while, I can't go outside without a mask. I'd feel like, totally irresponsible to be putting the people around me at risk. And so my mindset has changed. If you see what happened in the Czech Republic, that also don't have a history of mask wearing, don't have a culture of mask wearing. There was a big social influencer campaign there, and they got to 100% mask wearing in 3 days. And basically what happened was it quickly got to the point where if you went outside without a mask, people would look at you funny.
You were shamed.
Like, yeah, it's like, excuse me, I'm wearing my mask. I'm protecting you. You are not doing me the same courtesy. I guess you don't care about the people around you.
Will we get that way, you think? We might need to.
I mean, why not?
Right.
I'm more familiar with Australian culture than American culture, but I feel like in Australia, people want to be good to the folks around them in their community. And from the 7 years of experience I've had in the US, I see the same thing here. I would be pretty surprised if Americans don't have that same level of care for their fellow citizens and community members to make that effort.
In Australia, we don't hear too much about what's going on down there, although I know Tom Hanks and his wife contracted it down there. How bad is it in Australia? Because it's part of the Southern Hemisphere, it's certainly a lot warmer down there too.
Yeah, absolutely. And so some modeling we've looked at does suggest that temperature and humidity has a pretty significant impact. The science is not 100% on this, but it seems likely. So I do worry for my friends and family back in Australia as winter comes around that it could be even worse. And I hope, like nothing else, that they figure out mask wearing, testing, contact tracing before winter hits.
Well, you're an entrepreneur. I know you've been a part of startups in Australia. I can only imagine the great minds that are colliding right now, not only in your country, but in the Silicon Valley and all over the world to not only on the business side, but the medical side to try to defeat this.
Well, and on the political side as well. So since I wrote my op-ed in the Washington Post on the weekend, so many people have reached out to me, and I found myself briefing senators and their officers from both the Democrat and Republican sides. I've found people from microbiologists, virologists, all kinds of fluid dynamics professors reaching out to me and wanting to share information to help get this message out there that mask wearing is important. It's scientifically validated. It's healthy, and it's it's really something we should all be doing to help each other.
Yeah, no time to be vain. I must admit, I was outside Costco. I had a surgical mask in my car, and I thought, I'm okay. I'll get in and get out. And
Yeah.
I looked at the line, and a lot of people were close together, and I would say more than half had masks. And I said,
Oh wow.
it's
Great.
time.
Amazing. It's
Time.
amazing that's happened, and it'll probably tip super quickly from here, because once you get to that point where if you're the one guy in the line without a mask, everybody's looking at you funny.
Like,
You'll
hey,
certainly
come
wear it
on.
next time.
Yeah. Any last thoughts you'd like to share with us, Doctor?
No, it's all good. Thank you.
All right. Dr. Jeremy Howard with UCSF, research scientist. Some great insight on wearing masks, and I think we're all going to be doing that very shortly. Thank you, Doctor. Really appreciate it.
Thank you.
All right. I'm Frank Mallicoat with Fox here in the Bay Area now. Back to you.